share with you the argument that's to be made around recruitment and retention and how that can really help the health and human resources challenge that we're seeing today. In the business world, it takes 5 to 20 times the amount of resources for businesses to obtain a new customer than to retain an existing one. Despite this, customer retention often gets ignored in favor of plans geared solely towards finding new shoppers. So if you're an organization that values workplace safety and culture, you may be seen as an employer of choice. And people who are out there looking at different employers in terms of who they want to go work for, they may choose you over someone else if they believe that you have strong ties to workplace safety and if those values align with their own. And we think that investing in health and safety measures really demonstrates a commitment to the employee's well-being, and in turn they give that back to the employer, and so overall you end up with a better workplace culture. When you have a safe workplace, you also tend to see fewer injuries. And so what that means is all that work that you put into onboarding new staff and the recruitment efforts, they end up paying off because you get to keep those people at work and you get to have them grow with you as an organization. So we really think there's a strong argument to be made between recruitment, retention, and how that can support some of the challenges that you're seeing around health and human resources.
You're going to hear that theme a lot throughout the presentation today. And I'm starting to really envy the little cue cards that you had at your presentation right before this instead of my big pieces of paper, but bear with us. So on this slide are 2 examples that speak to balancing recruitment and retention while also taking care of those giving care in your organizations. So the first one is from Caltech. It's the Health Human Resources, addressing staffing shortages in long-term care, and they published it in October 2022. And it states, even as long-term care sector looks to recruit new staff, long-term care homes must continue to ensure they retain the staff who currently work in their homes. And then from Quality Work Life, through the Quality Healthcare Collaborative, they state a fundamental way to better healthcare is through healthier healthcare workplaces. It is unacceptable to work in, receive care in, govern, manage, and fund unhealthy workplaces. And the Continuing Care Act that will come into force early next year includes a preamble that confirms quality of care and taking care of staff are critically connected. And that preamble states that staff who provide continuing care enhance the quality of life of residents and clients. Well-trained and supported staff are vital to the continuing care system. So we have 3 goals for today. They are to recognize health and safety culture plays an important role in employee retention, learn how safety associations can support your health and safety culture, and identify practical opportunities to engage with your safety association. So we just thought it would be fun to find out how familiar you are with either CCSA, the Continuing Care Safety Association, or SafeCare BC. So just by a show of hands, how many of you are familiar with one or both of our organizations? That's pretty good. That's pretty good. So for those of you that already know us, this will be a bit of a review. And for those of you that don't, here's a little bit about us. So I'm going to tell you a little bit about the CCSA, and then Saleema is going to tell you a little bit about SafeCare BC. So we are the safety association and certifying partner for the sector, meaning we work with our members to achieve excellence in care, safety, and well-being, making a lasting impact on the continuing care industry. We're a not-for-profit association funded primarily through a levy on members' WCB premiums. And our members come from WCB industry rate groups 82800, which is Senior Supported Living Lodges, and 82808, which is the Continuing Care or Long-Term Care. We were established as the Funded Health and Safety Association for Long-Term Care in 2005. And in 2007, Senior Supported Living Lodges joined CCSA by a special resolution. In 2009, we were awarded the first of a 5-year grant from the Alberta government to support the No Unsafe Lift Best Practice Framework. And that was launched to address escalating musculoskeletal injuries in continuing care and senior supported living lodges. The grant funding remained in place from 2009 through 2017, and it supported development, implementation, and operationalizing of CCSA's injury reduction program, which enabled us to support a limited number of continuing care employers each year to both improve their OHSMS overall occupational health and safety management system, and train their employees at no direct cost with a specific focus on reducing MSDs. Because of the grant funding, we were able to support over 200 sites or communities and train more than 12,000 employees over its life cycle. Throughout the first 15 years, with the exception of IRP, our primary services were classroom-based education and administering the Certificate of Recognition program. However, we've been listening and learning from our numerous interactions with our members, and as a result, we have modified our service delivery to a model that is more flexible, scalable, and sustainable. And we'll talk a little bit more about that as we go through the presentation. But in particular, over the past 5 years, we have transitioned from an organization that was mostly known as a training, education provider, to one that is so much more than that. As we've grown to become a trusted leader for health, safety, and wellness in Alberta's continuing care sector. Well, just a little bit more about who our members are. So of the 375 members, 227 come from senior supportive living and 148 come from long-term care. Now that 375 represents WCB accounts, and it's not representative of the actual number of facilities or communities that that make up continuing care and senior supportive living across Alberta. Because we represent so many employers across the province, large and small, rural and urban, private and not-for-profit, CCSA is in a unique position to provide insight into industry trends and issues and the impact of change within this growing and dynamic sector. Our goal is to make sure the 375 member organizations and the approximately 34,515 workers in the sectors thrive as a vital component of communities supporting loved ones across Alberta by reducing workplace injury and supporting mental health and wellness. Now that FTE, if anybody is wondering, is just estimated by WCB Alberta, and it's based on the industry average wage. But we do know that the actual number of workers in Alberta continuing care and senior supportive living is significantly higher just because of the high volume of part-time and casual workers that work in the communities and facilities.
So just a little bit about SafeCare BC. Essentially, an easy way to think of it is that Dana and I are essentially clones of each other in different provinces. So I run the Safety Association in British Columbia. We also support long-term care. There's a small levy that's applied to the insurance premiums that long-term care operators pay in BC to fund SafeCare BC. We are actually relatively new, so we were founded in 2014. We're going into our 10th year of operations next year, so we're very excited about that. 2 years into operations for SafeCare, we identified that there was a lot of overlap between the home and community care sector and long-term care. And the risk profile and the injury types that we were seeing in home and community care were actually quite similar to what you see in long-term care. So the SafeCare BC board decided that they would like to expand into home and community care. So we did that in 2016. And what we've had to really look at doing with that expansion is make sure that the language that we use speaks to kind of both groups. Similar to the Alberta Continuing Care Safety Association, we represent about 30,000 workers, and that's FTEs across the province. And then we opened up, so we've got about just over 800 levied members between long-term care and home and community care. And in 2019, we found that one of our strategic priorities was to influence the people that were coming into the sector. And so we found that the way to do that would be to open up associate membership options for post-secondary institutions that were training students to become care aides or nurses. So in 2019, we launched associate membership options for these groups. And since then, we've welcomed about 10 post-secondary institutes into our SafeCare BC family. And they pay a fee based on their total payroll. So a little bit different than our levied members, but what we find is a lot of the schools that we work with will then send their students into our member organizations, and they go in with a lot of the education and training that we provide. So then the language that is shared amongst the organization is in alignment. One more thing I'll say very quickly is that as we look ahead into our 10th year, we're actually seeing a lot of overlap between the injury types that we see with long-term care, home and community care happening in assisted living and independent living. So we've recently been really working with that sector to see how we can potentially expand and continue to support the workers who really span across all of these sectors. So we're hoping that today's workshop can be a bit interactive, and we want to hear from all of you in the room. So sorry we didn't give you advance notice of this, but we've kind of shared a little bit about, you know, how focusing on recruitment and retention and having that health and safety lens can really help you with some of the health and human resources challenges that you see. So our question for the room, before we get into some of the strategies that we can share, is health and safety part of your retention strategy? And if so, are there any brave people in the room who'd be willing to share?
I can.
Yeah.
Ours is, I'm from 𝗔𝗱𝗺𝗃 in Sherwood Park. So we put all of our staff through, regardless of FTE, body mechanics training on hire. We also encourage them to take part in our health and safety committee and provide the training through you guys for that. And we also provide, you know, extra courses and stuff, just saying, you know, that we do prioritize safety, and that while you're working here, that your safety is one of our concerns.
Thanks for sharing that.
Fantastic.
Is there anyone else in the room? Anyone with a rewards and recognition program, anyone who has a, you know, functioning joint occupational health and safety committee, those are all steps that you can take towards improving your health and safety program, and we know that it has an impact on retention. So perhaps you're not, you know, you might not see the link, but we definitely see it in the data, and we know that it's there just from even talking to operators that take part in this. Some of the ideas that we wanted to share around what you can do as an operator to help you with your retention strategy, and really links back to occupational health and safety, is knowing the number of injuries that are happening in your workplace, knowing how long people are off for when they have an injury, looking at the types of injuries that you're having, making sure that you're investigating all of the injuries that happen at your workplace, including near misses, so ensuring that those are being reported and then investigating them. And then making sure that you have a good return to work program. And this goes for both physical injury, but also psychological injury. So are you following up with staff when they've had an injury? Are you letting them know that they're still connected to the workplace? There's supports in place that they might want to take part in, so that when somebody does go off on an injury, they're not just off for, you know, a period of time. They're remaining connected with the workplace, because we know from the data that if you can stay connected with staff when they are off on injury, they're more likely to come back sooner. So it actually saves you as an employer some money around how much you're paying in your premiums. We also know that if you're looking at the stats, it's easier for you to target your prevention efforts. So there's so many different ways you can look at your health and safety program, and different areas that you can put your attention towards. And we know that you guys are all very busy, but if you know if you're having more musculoskeletal injuries, or if you have more people off on psychological claims, then you kind of know where you might want to focus your efforts.
So Saleema talked about you knowing your data at your organizational or your community level. One of the things that a safety association does, and Saleema's talked about knowing the data, is we look at it from an industry perspective. So the next few slides I'm just going to go over very briefly, because I know data can put everybody to sleep, and we just had a nice lunch, so I don't want you to have a nap when you're in here. But we'll look at some of the injury data for Alberta continuing care and senior supportive living sectors. So on this side specifically, without COVID claims, which is on your left-hand side, we can see that the lost time claims rate, which is the number of lost time claims per 100 workers, saw a year-over-year increase of 7% between 2021 and 2022. But since 2017, that LTR has increased by 24%. On the right side, the second chart demonstrates the significant impact of COVID, and it's a strong indicator that we'll continue to see its effect on WCB premiums for the next 3 to 5 years. So where are those injuries coming from? Well, this chart shows the top 5 injuries by number of injuries for continuing care and senior supportive living lodges. And you can see, again, the significant impact of COVID. COVID's kind of the teal line, and you can see how it really, all of a sudden, 2020 came into play, continued throughout 2021, and then really exploded again in 2022. But we are obviously still seeing some of those claims coming through and accepted by WCB even this year. What might be surprising is the ongoing prevalence of MSD injuries common to both continuing care and senior supportive living lodges. So you can see it's always been, historically, the #1 reason why workers are getting injured in senior supportive living and long-term care. It did take a back seat in 2020 and 2022, but other than that, it's always the number one reason workers are getting injured. To understand the other top five injuries, which is the bruises, contusions, fractures, and non-specific injury disorder, we would need to see who is being injured and the primary source of injury. And when we look underneath that, we typically see the who, our nurses, orderlies, or healthcare aides, obviously. And the primary source of injury is typically residents. So this slide just talks about workdays lost. And when we, according to Caltech, as of the final quarter of 2022, there were over 38,000 vacant positions across Canada in long-term care homes alone, more than double the vacancies in 2019. And that's from their Health Human Resources Insight, the unique challenges of staffing in long-term care homes from May 26th of 2023. So on this side, you can see the total number of workdays lost, specifically for continuing care and long-term care, and you can see the impacts of COVID versus not COVID. But what this means is employees who were not at work due to work-related injury or illness, and this equates to, so if you take the total number of workdays lost, there's a calculation to tell you how many full-time equivalent employees are out of work in continuing care at any given day due to workplace injury. We know that in 2019 it equates to about 54 FTEs lost. By 2020 that had jumped up to 210 FTEs lost. In 2021, it was 138, and in 2022, it was 131. But that's still more than double what we saw in 2019. On the next slide, we're going to look specifically at senior supported living lodges. Again, a very similar trend, although you'll see that the delay was a year. So in 2020 was the big year for continuing care and long-term care. In 2021, that's when we saw the largest number of injuries in senior supportive living in lodges. So what this equates to, as far as number of workers out of work due to a work-related injury on any given day, in 2019 it was approximately 37. In 2020 it was approximately 56. In 2021 that had jumped up to 71, and by 2022 that equates to about 60 FTEs lost. So next we want to talk a little bit about mental health. We've heard a lot about that. Certainly a lot of the speakers today are talking about that. You heard that again, that theme in Minister Smith's speech as well, and in the Q&A that she answered. In 2017, there were 23 mental health related claims accepted by WCB in continuing care and senior supportive living lodges. That number has risen to 39 in 2022. Perhaps more telling, however, are the escalating costs of mental health related claims. As depicted on the chart on this slide, the cost for mental health related accepted WCB claims rose to $771,969 in 2021. That's 279% higher than it was in 2017. While the cost decreased in 2022, they're still 230% higher than 2017. But it's really important to note that these costs will continue to grow. This is just a snapshot in time. So we'll continue to see the claims that were accepted in 2022, those costs continue to grow as we refresh the data. So now another little fun interactive activity. So how many of you have used services from the CCSA or SafeCare BC? Anyone used? What services have you used?
Your education.
Our education and training? Yeah, fantastic. Are there specific courses you take with us? Or?
I think we did it's from Brenda Stratford.
Yes, yeah.
So
Brenda Stratford's a core holder as well, yeah. Mm-hmm.
So yeah, I can't name them all, but
yeah.
I know that
Fantastic, and Brenda Stratford was also in the IRP program, I believe, back in 2011, 2012. And SafeCare, of course, we do a lot of work, or no, ShareCare, we do a lot of work with ShareCare.
Yeah, we've used from the body mechanics to the new portal you guys put up. I put some people through health and safety.
Fantastic, yeah.
Anything, yeah.
Great. So for those of you that have, the two of you that have, you might learn about a new service today that you didn't know that we had. For those of you that haven't, hopefully you learn about how we can support you to take care of your team while giving care. So while our safety associations have similar mandates and approaches, we're going to speak specifically to the CCSA experience over the next few slides. So at a high level, we equip leaders in Alberta's continuing care sector with strategic insights and guidance to ensure the sector is a beacon of care with the highest standards for workplace health, safety, and wellness. So going back to our revised service delivery model that is flexible, scalable, and sustainable, and as mentioned, our members are diverse and dynamic, a one-size-fits-all approach does not work, nor is it sustainable. Instead, we scaffold our services to suit the breadth of our members' needs, allowing them to access and engage with us based on what their needs are at the time. Over the next several slides, we'll review our prevention, promotion, and protection services we employ to make sure continuing care organizations and professionals in Alberta have everything they need to do their jobs safely and to create positive work environments. We'll also highlight the impact that we have through the services that we provide, and that's because we measure how well we're doing, and we do it in a variety of ways. And we won't go through all the ways that we measure that, but we'll highlight a few key areas, a few key measurements that we use to tell us how we're doing. So we're going to look at prevention first, and essentially you have a lot of control, or your employers have a lot of control over health and safety in your organizations. Prevention services support employers to implement best practice health and safety programs, supporting them to be employers of choice and that employees want to stay with. We include a variety of services, some free and some with a nominal fee for service, designed to support you to implement and continuously improve your health and safety program. The Health and Safety Toolkit, as an example, it includes all of the tools needed to implement health and safety, assess your current program, and continuously improve it. All resources in the toolkit are free and can be downloaded off our website, then customized to suit your organization, so you don't have to start from scratch or use AI that's generated from non-healthcare organizations. If you're not sure how to improve your program, the Member Assistance Program, which is also free for members, offers you the opportunity to work with CCSA to identify your health and safety management system gaps and then develop an action plan. And unique to the CCSA, we are also one of 11 certifying partners in Alberta, and we're the only one focused on continuing care. So we can assist you to achieve and maintain your certificate of recognition if that's a direction your organization wants to go in. I'm going to focus specifically on training and education as a prevention strategy over the next couple of slides. But back to scaffolding our services, this goes the same for our education and delivery model. In 2020, we successfully transitioned our delivery model from exclusively classroom-based to virtual instructor-led training. And then in 2022, we successfully launched our learning management system, and we'll add 2 new on-demand courses this year. This model enables us to quickly scale operations to meet our members' changing training and education needs with minimal impact to other services. So how do we know whether training and education that we provide is meeting our members' needs? Well, as I said, we measure it in a couple of different ways. So first, we survey our members, and in 2022, when we asked whether the quality of CCSA training is meeting expectations, 100% of those who responded to the survey said yes. We are successful because our education and training programs are designed specifically for Alberta-based continuing care and senior supportive living lodges, with integrated real-life examples gleaned from those facilities and communities we've engaged with across the province. We also survey those individuals who attend our education and training courses, and this year, 99% of participants say they will be able to apply what they have learned to improve safety at their workplaces. Simply put, we take the pressure off executives by producing high-quality health, safety, and well-being training, resources, and support, so they can come to us as a one-stop shop and not have to worry about starting from scratch. While we've always been focused on collaborating with and sharing best practices with our members, in 2022, in the 2022 member engagement survey, we heard that our members wanted CCSA to continue to grow opportunities to learn from each other and our partners across the country, as well as have easy access to a variety of resources to use with their teams. Promotional services build employer and employee awareness of key industry-specific health and safety issues and shares information designed to support just-in-time leading workplace health and safety activities that support a positive health and safety culture. I'll highlight just a few of our solutions to promote workplace health and safety through effective communications and collaboration. Firstly, safety segments. with a new safety segment released every month. In them, members have a one-stop shop Safety Huddle Toolbox Talk resource that is more than just a piece of paper posted on the OHS bulletin board. We also have our YouTube videos, and the CCSA YouTube library has been steadily growing. It includes videos to complement the safety segments, as well as videos that can be used for on-the-job body mechanics coaching, or to learn about a new OHS best practice, just to name a couple of ways to use them. Lastly, OHS collaborative discussion forums. These are hosted in collaboration with ACCA and ASHA. Every quarter, we host a presentation on a health and safety topic with expert presenters. And the next forum is October 19th, and it'll feature Millard Health, introducing the cognitive psychosocial job demands analysis. Those are free for members to attend as well. So how do we know our promotional activities are effective? Well, in 2023, we engaged 𝗥𝗲𝗽𝗆, who's a marketing and communications company. And during that engagement, they interviewed CCSA members who said, CCSA's newsletter reigns supreme. All interviewees referenced the newsletters as their main point of contact and referred to this channel as a valuable resource for information. So if you're not subscribed to CCSA's newsletters, subscribe to them. 96% also say they received support from the CCSA when they need it. Supporting our members to take care while giving care, we have developed and continue to launch programs that are packed with resources, tools, and education training specifically designed for the industry and developed in collaboration with key partners and experts. Protection programs help employees feel their employers recognize what could hurt them at work physically and mentally, and assist employers to address these specific areas. For example, our psychological health and safety program, which we launched earlier this year, includes pathways for prevention, promotion, and protection. You can see the theme that we're talking about here. The prevention pathway includes the Working Mind long-term care education program, and we have some sessions booked for those in October and November, and soon the Working Mind Senior Supportive Living education program that we are developing with the Mental Health Commission of Canada and our senior supportive living employers here in the province of Alberta. The promotion pathway includes resources developed through the OHS Prevention Initiative, and it includes, it was focused on key Alberta OHS system priorities, including musculoskeletal disease, psychological, psychosocial health and safety, and slips, trips, and falls. And then the protection pathway includes the Violence, Aggression, and Responsive Behaviors Toolkits for Continuing Care and Community and Seniors Housing that we licensed from the Public Services Health and Safety Association. 95% of survey respondents to the 2022 member engagement survey said that CCSA's programs and services meet their expectations. And that's indicative of our commitment to implement evidence-based programs through partnership and leading expert organizations. For example, the VARB toolkits we licensed from PSHSA have been studied in 2019 and again in 2022. The first, which is called the final report, the evaluation of the VARB toolkits, and it was commissioned by PSHSA in 2019. That evidence-based evaluation of the 5 VARB toolkits was undertaken to better understand the toolkit's awareness, use, and effectiveness. The tools are having a positive impact on how healthcare organizations prevent and manage workplace violence, with 89% reporting that the tools improve their processes, programs, and systems. And then again in May of 2022, the Journal of Nursing Administration published a paper by a large US healthcare system that examined the efficacy of patient violence risk assessment tools. PSHSA's violence assessment tool, which is found in the Individual Client Risk Assessment Toolkit, was rated the highest of those reviewed. The project team recommended that the PSHSA violence assessment tool as the instrument to be used across the care continuum within their healthcare system. We believe there's tremendous power in safety associations being separate from the regulators who are WCB Alberta and Alberta Jobs, Economy and Trade, as it allows us to create and deliver Alberta-based, industry-specific health and safety prevention, promotion, and protection services rather than generic and often construction or energy-centric resources. It also affords a unique perspective, one rooted in and informed by the reality of continuing care and senior supportive living lodges. The fact that 98% of respondents to our member engagement survey also feel that being a member has had a positive impact on their organization is proof that our members also see the value in what CCSA does to support them to create positive, healthy, and safe cultures that are workplaces employees want to stay and grow with. By fostering a culture of trust and partnership through the support we provide, we enable leaders to achieve operational efficiency, financial stability, and sustainable growth in their organization.
So Dana's done a great job of highlighting a lot of the programs offered by CCSA. I just wanted to take a few minutes to talk about some of the SafeCare BC programs. There's some overlap, and we're always learning from each other as safety associations about how we might want to tweak our programs once we see kind of what's working in one province and what's effective. So we offer around mental health. We have a program called Care for Caregivers. This launched in 2020, mostly around the pandemic. We partnered with the Canadian Mental Health Association, the BC division, to launch a service that provided peer-to-peer support for healthcare workers who are in distress. It gives them access to a free and confidential call line that they can reach out to. And we're seeing a lot of people still using this service. We've diversified the way that they can call in, so now they can also text. And we're actually seeing a lot more healthcare workers use the texting service, primarily before and after their shift. So we're in BC, one of the issues that seems to be bubbling is around workplace incivility. And we have a lot of healthcare workers reaching out to the Care for Caregivers service to get help with how to deal with one of their coworkers or colleagues before going to work, and then helping them decompress when they get off their shift before they go home to their families, because they're worried about taking that anxiety home to their kids and their families. And also through the Care for Caregivers program, we offer monthly free webinars on emerging topics. So we do things like coping with anxiety. We have done things on dealing with death, lots of things around self-care, compassion fatigue, moral distress. We find topics that are relevant to workers in the moment, and they have ways of reaching out to us, and then we find experts that can speak on those topics, and they're free and they're available to all healthcare workers in the province. On the self-care theme, we have an annual conference called Hearts and Hands that's dedicated to healthcare assistants, and we offer this every year. And it's a whole day designed for healthcare assistants to go through a series of sessions on various topics that are affecting them. This year we've got 3 conferences coming up in the next 3 weeks. We're doing one kind of in the lower mainland, and then we also do 2 in slightly rural areas so that we can make sure that we're getting to the whole province, and recognizing that it's hard to get healthcare workers off their shift and attend the conference. We also offer a digital conference. So I should actually start saying that we do 4 conferences. I have a board member in the room, so 4 conferences that we do. But it's really nice that we're able to do this. One thing that we've heard is we're the only venue for healthcare assistants to be able to come together and have an event that's dedicated just for the work that healthcare assistants do. Safety Den is similar to, Dana was talking about innovation and looking to each other for learning. Safety Den is an event that we offer annually at an industry conference, where we encourage operators to bring forward ideas that they've implemented at their site to improve workplace health and safety. And then we put a bit of a Dragon's Den spin on it. They come up and they present to a panel of judges, and then they're awarded giant checks, like the ones you can see in the picture, that range from $500 to $1,000, so that you can take it back and actually continue to make that program even better at their organization. And then the last one that I'll mention is our tailored outreach program, which is essentially a one-to-one consulting service for our members. So if they want to identify where their gaps are in their health and safety program, they reach out to us. We send a safety professional out to their site. We go through an entire assessment with them. We identify where their holes are in their program, and then give them resources to fill that program. So this is a hugely successful program for us. You can see there from the quote, "Top complements what we're already doing and shows our staff and clients that we're accountable and responsive to health and safety." And the fact it's coming from SafeCare BC lends credibility to our staff. So this is a program that we really have been promoting for the last 6 years, and we continue to see growth in the tailored outreach program. And similar to Dana, we are always surveying our members. We're looking for ways to get feedback so that we can make our programs better. And so with the TOP program, it's had various iterations over the last few years, so that we can really make sure that it's hitting the mark for what people want.
Yeah, and I was gonna say, for the Hearts and Hands Conference, CCSA this year awarded 5 healthcare aides from Alberta, 4, actually 5, and the 5th one wasn't able to come, so 4 are gonna come. They're going to the Kelowna Hearts and Hands Conference, and CCSA is footing the bill for all of their expenses. So we just wanted a way to recognize healthcare aides in the province of Alberta, and we looked to SafeCare BC, and we received 33 nominations, and we did a random draw, and 5 were successfully awarded that. So we're really happy to launch that this year, and we'll continue to do that moving forward.
And we're really excited about that because we've never had anyone from out of province attend any of our conferences. So it's a milestone for us. We've had a lot of interest across Canada for a digital conference, but never the in-person. So we're excited to host. And we just wanted to share a little bit about how the safety associations really come together to make sure that members can benefit to the full extent. So Dana and I belong to a group called NASH, the National Alliance for Safety and Health in Healthcare, and it's made up of 8 health and safety associations across the province. And we work together, we meet once a year, we have regular meetings, and this is a great way for us to make sure that we're kind of staying ahead of emerging issues. Sometimes what's bubbling in one province hasn't quite hit another one, so we'll use this as a way to kind of ask what's happening. We also use it as a way to kind of share what programs are happening, so we're not reinventing the wheel. We're being fiscally responsible to make sure that we're leveraging what's already out there rather than creating new programs and resources. And so there's been some great examples of that through the work that we've done with NASH. I think Dana talked about the violence risk assessment tool, which we've all leaned on the Ontario Health and Safety Association for. We've recently developed a vaccine education course, which the Alberta Continuing Care Safety Association has licensed from us. So it's nice to be able to share those resources. We really try and operate on these principles around leadership, collaboration, and we do have a very strong shared vision around the work that we do. One of the nice things about NASH is we've been asked to sit at a table with the Association of Workers' Compensation Boards across Canada. And as they work to develop a mental health strategy around regulation, they've looked to NASH to sit at that table and inform some of that strategy and share what resources we already have so that they can incorporate that into the national strategy. NASH has also been asked to attend the World Congress on Health and Safety Conference that's coming up in November in Australia. So 2 of us from NASH will be going out to Australia and speaking on the world stage about our collaboration and how health and safety associations work and why they're a good model, to Dana's point, to complement the regulator. A lot of times organizations don't want to go to the regulator, and the Health and Safety Association is really there for them to support them through some of those challenges, so they don't feel like they're going to be slapped with an order or a penalty. Instead, they can come to us for more of that supportive arm.
So we hope that today we have just demonstrated through prevention, promotion, and protection services that Alberta-based or BC-based and specifically focused on the continuing care and senior supported living industries, safety associations play a critically important role in assisting employers to take care while giving care through the creation of a positive workplace health and safety culture, and in turn are workplaces that employees want to stay and grow with. So that concludes our presentation. We're just wondering if today you learned anything. So would anyone like to share an actionable opportunity that you might take away from today's session?
And to take the pressure off, it can be a kernel of a thing that you're going to go back. Like go back to your workplace and read a policy. Something really small that's actionable that you can do to promote workplace health and safety in your organization, no matter how small or big it is. I'm looking at someone who has a small organization. There might be something there. So we're curious to hear from the group on what you learned from today.
What I've learned today is really connecting the retention factor with health and safety. We have in our organization, it's definitely one of our strategic priorities, quality and safety, but linking it to retention, we have an opportunity there. So I really appreciate how you brought that together.
Fantastic, thanks.
I have a question for you.
Sure.
Yes, building on Sharon's comment. Do you have any examples of creative ways where operators have used health and safety as a recruitment tool? So I imagine there's a bit of word of mouth involved, but how else is it used by operators for recruitment?
I can speak to one example. So our Hearts and Hands conference offers an opportunity for employers to set up booths at our conference so they can connect with other healthcare assistants and people that work in the sector. And so we get a lot of interest from employers wanting to set up booths at all 3 of our conferences. This year we've actually, in BC it's a little different, we've got 5 health authorities across the region. So rather than just having Alberta Health, we've got, they're kind of spread around. And we've got each of the health authorities attending the Hearts and Hands conference, setting up a booth so that they can connect with frontline workers and use that as a way to speak to the benefits that they offer if you were to go and work for them. So we don't promote poaching at the conference, but we found that a lot of people do use the Hearts and Hands conference as a way to do that. I've also seen some really good stories come out of the work that's done with joint occupational health and safety committees, and using that as demonstrating to workers that they really have a voice and a say in the way that work is done. And having that autonomy, we know, is one of the greatest factors around psychological health and safety. And so a lot of times employers will use that as a recruitment tool to be able to demonstrate to new people coming into their site about how they have a voice and a say in the way work is done, and in terms of what equipment is purchased to help them do their job safely. So I've heard a couple stories around that as well.
Yeah, and I'd say in Alberta, the Certificate of Recognition program for those employers that do achieve core do use it as we are an employer that takes care of our employees, and we commit time and resources to a health and safety management system that's evaluated, and through that we have achieved core. So there are some employers who use the core program as that recruitment and retention opportunity for sure.
Thanks.
Anyone else?
If the site was going to start a program or needed assistance, like how much help do you provide on site, or is it just like here's the package, or?
Well, we, as I said, we do it in a multitude of ways because we know not one approach is going to suit everybody. So we have the health and safety toolkit where you can literally go through every element that's required in a health and safety program according to Alberta legislation and then some. And you can pick up the policies, procedures, job descriptions, hazard assessments, and controls. You can pick up anything that you need on the health and safety toolkit, take it and make it your own. If you don't have the opportunity to do that, or if you're not sure how to do that, then you can connect with CCSA and we can provide that support. Often we provide that support virtually, remotely, but we can go on site. We've done 2 other things. One is a health and safety program review where we can go into an organization, SafeCare participated that in the early days, and basically we go through a system that's similar to the Certificate of Recognition program audit, but not as rigid as that process, and we identify how your system is, compare your system to the legislative requirements and provide you with a report that tells you here's your opportunities, and then develop an action plan in collaboration with the member to help them get there. And then through that action plan, we can identify ways that CCSA can support, whether it's through the free training options that we have available, or through an instructor-led session, be it virtual or in classroom. Yes?
I have got one comment and then a couple questions. With regards to the actionable opportunity, I think it is important to note that both of you mentioned mental health. And obviously, with Minister McGrange's announcement of the $2.5 million mental health project funding, clearly is tip of the iceberg, is something that collectively we're focusing on. So I guess my question, or the opportunity of action, is obviously the opportunities to focus on workplace safety from the mental health perspective. The questions I have is, number one, Dana, you mentioned, and you've shown some statistics about the cost of mental health injury and the increase in claims. But can you expand a little bit more about, with some context as in how it has changed historically in scope compared to physical injury? And second, with Saleema here, I wonder if there's any discernible differences, because we're neighboring provinces, in both the combination or the ratio of physical versus mental health related claims in the two provinces, particularly over the last few years in the COVID experience.
Sure, so that the escalating costs of the mental health related claims that are accepted by WCB, just the first question that you answered, there's a multitude of factors that go into that. I think what we saw when the legislation changed in 2018 here in Alberta, and the inclusion of social well-being, the requirement to have violence and harassment prevention plans. So just creating that awareness that is now a legislative requirement for employers to protect their employees, not just physically, but also their psychosocial health, I think is a big factor in the escalating costs. We're also hearing from WCB that just the types of mental health claims that they're receiving are so complex that they're a much longer duration claim than what a physical claim would be. Where you can say somebody broke their leg and they automatically know it's going to be 6 weeks that they're going to be off, and then they're going to be back to work. You can't make that same estimation with a mental health related claim. So there's a number of factors that are going into that escalating cost for sure.
I think the other thing that we're seeing is historically, you would see a mental health claim pop up as a secondary cause. So somebody would go off on a claim because of a violent incident at work, and they'd be off because of a physical injury due to that violent incident. And then over time, as they're at home recovering, they realize that actually there's a mental health component as well, and then it would get reported that way. So mental health would be a secondary component. Now we're actually seeing that flip, at least in BC, and so it's the primary reason that people are reporting the injury is because of mental health. And in BC there's a shortage of psychologists, and they're often needed to make a decision on a claim, and so then people are off work for even longer, and so mental health claims end up being longer in duration for all the reasons that Dana said, but also because of access to the professionals that you need to support the individual through that claim and through the process.
Yeah, I was just going to say one more point. The other point is it's really easy to develop a modified work plan to get somebody back to work and not on claim for a physical claim. Somebody broke their leg, they can come back and they can do some filing or whatever it is that's in your modified work program. That ability to find appropriate modified work for a mental health related claim just hasn't been there. And that's why Millard Health and WCB Alberta is now trialing the cognitive psychosocial job demands analysis form to help facilitate that process.
And I think the other thing is on the mental health side, we know that when someone goes off on a claim, it is a long process. So the key is really in the prevention. So what are you doing at a site level to prevent people from going off on a psychological safety claim? And we're fortunate enough that it's not perfect, but there's a national standard that has 14 factors that will tell you that if you can focus your attention on these factors, you're likely to promote a psychological health or psychologically safe workplace. And that's a really good way to keep people at work, so on the retention side, but also prevent them from going off on a mental health claim.
Yeah, for sure.
You asked about the numbers between BC and Alberta. I didn't put mine up there because when I looked at Dana's, they're actually quite similar. The only difference, and the other reason we didn't want to put them up there is because the way that claims are processed in BC and Alberta is actually quite different. So even though the numbers look the same, there's a lot behind the numbers that's different, and so we didn't think it made sense to share them.
Yeah.
And if I may, just a follow-up, and you mentioned about, Dina, you mentioned about the legislative changes to address mental health. Does the COR, the core program, reflect those changes? And what, obviously we're talking, I think Jennifer mentioned a question about using certification and such programs as a tool to not just retain but recruit. Are those new requirements in legislation also reflected in the COR?
Yeah, the requirement to have the workplace violence and harassment prevention plans is embedded in core. And then really I'd say what else is embedded in core is the internal responsibility system. So helping to keep employees engaged, their right to know, their right to participate, all those sorts of things are embedded in core. Psychological health and safety more holistically and exceeding what's required in OHS legislation isn't reflective in core, I would say at this point in time, but there is some work going on behind the scenes to develop a psychological health and safety element that would complement core and would allow employers to evaluate their psychological or psychosocial health and safety program against a provincial standard or against the national standard that Saleema spoke about. So there's some work underway on that.